With the ruling from the Supreme Court several weeks ago saying that states can opt out of Medicaid expansion for God knows what reason. It was a fairly ridiculous ruling, but nevertheless. And we know that at least 10 or 11, maybe up to 16, have signaled that they won't. There's about 7 or 8, I think, who have vowed that they won't. Republican governors saying they're not going to let the federal government push them around and provide health insurance for poor people there at what would be ultimately probably a savings for the states. Federal government going to fund 100% of it for the first couple of years, scaling back to 90% of full funding from the federal government. And that other 10% would probably be offset by the fact that the state wouldn't have to deal with all the implications of having so many people uninsured. And aside from the political aspects of it and the cost aspects of it, a new study published Wednesday online in the New England Journal of Medicine by some Harvard researchers, no slouches up there, found that when states expanded their Medicaid programs and gave more people health insurance, this is going to come as a shock to you, fewer people died.
Surprise, surprise.
And apparently, there's just not been many studies about this. It's very hard to sort of control the experiment. It was conducted by researchers from Harvard School of Public Health. They analyzed data from 3 states that had expanded their programs in the last decade to cover a population not normally eligible for Medicaid. You'll recall Republicans were crying about this recently. It provided low-income adults without children or disabilities Medicaid coverage. Researchers looked at mortality rates in those states, New York, Maine, and Arizona, 5 years before and after the Medicaid expansions, and compared them with those in 4 neighboring states, Pennsylvania, Nevada, New Mexico, and New Hampshire. They controlled for all other social and economic factors. And they found that the Medicaid expansions were associated with a decline of 6.1% in deaths, or about 2,800 deaths per year for every 500,000 adults added. It was greatest among non-whites and people living in poorer counties, groups most affected by the extended care. There is another study being done by the same group in Oregon. Oregon expanded its Medicaid program in 2008, but without money to cover everyone at first, they chose 10,000 people by lottery. They compared those who got Medicaid with those who did not, and so far, and these results are not conclusive, found that Medicaid recipients see doctors more often and report better health and better financial stability. Medicaid works. It's going to suffer a financial problem because of the increase in health costs. Let's put it this way. It's not going to suffer any more of a financial implosion. In fact, it will suffer less of one than the private health insurance industry because the costs of medicine are rising both for private insurers and for public insurers like Medicaid and Medicare. They happen to be rising faster at a faster rate for private insurers because, of course, Medicaid and Medicare have the capacity to slow the costs of medicine in a way that private insurers do not. So it's not just about the federal government pushing me around. I'm not going to allow it. In some of these states, it's also, I don't care if poor people die. Freedom. Freedom.